I'm Jeena. I'm working in Rekha. So these are my colleagues. This is Rekha and Intan. So we will be presenting today to use how to take care of catheter at home. Okay. So let's see what is catheter first. Okay. Catheter is a flexible tube that is inserted inside your bladder. So from the picture you can see this is for the male. The bladder is here, so the tube is going inside and it is in the bladder. So this is for the female. The tube is going inside and it is situated at the bladder. So it is permanently inside the bladder. So it will continuously drain out the urine. So the person who is on catheter will not feel any urge to pass urine. Okay. From here you can see that there is an opening. This one is called catheter. Catheter opening. Okay, then followed by one balloon. Okay, usually when they insert the catheter inside your bladder, they will push in sterile water. So the balloon will be activated. So the balloon will prevent the catheter from slipping out your bladder. So it is very important to inflate the balloon. Okay. So after that we have the urine drainage port and the balloon port. So from here you can see, okay, this is the balloon port and the urine drainage port. Okay. So the one thing that you all must remember is do not put any foreign body or any object inside this balloon port because it may accidentally deflate the balloon. So the catheter will come out. Okay. So do not do that. Okay. We go to next slide. Okay, let's see. This picture shows the parts of the urine bag. Okay. From here you can see this one is the connector to the catheter. Okay. So this is the one that we connected here. Okay. So this is the urine bag tubing and this is the baggage that the urine will collect. Okay. Okay, and this is the outlet that we can open up and close. This is where we drain out all the urine. Okay. Okay, we go to next slide. Okay. There are several types of catheters. These are the main three. One is latex, elastomer and 100% silicone. So in tandoxine we mainly use elastomer and 100% silicone. Okay. The name comes because of the content inside. So elastomer IDC can last up to 1 month. It can stay in the body. And if it is a silicone catheter, it can last up to 2 months. Okay.
The price different?
Yes. All prices are different. Okay. It depends on the material, the price is also different. Huh? Okay. So next we go to how to take care of this interlink catheter at home. Huh? Okay. Okay, the first most important thing is every time we say we need to prevent infection, right? So the first step is to wash hands before you touch the catheter and after you drain out the urine and all those things. Very simple, you can just use normal soap, rinse it off and you can just wipe it off with the tissue. It's just surgical gloves. At home it is your own urine, it's up to you. You can just use water and wash. It is not necessary to use gloves. Okay. Okay, the next one is the meter and catheter junction hygiene. That means the catheter that enters the body, if for female, it will go to your private parts. This junction is called the meter and catheter junction. That means this is the area where the catheter goes inside the body. And for the male is from here. Okay. So the one thing that you all must remember is when your loved one, especially they are bed bound and wearing diaper, right? So every time you all must, when you clean, you must open up this area and see whether the catheter connecting to the body, that part is clean or no, whether there is very discharges or crushes or no. You must remember to check. So if there is, you're supposed to clean it. And whenever you clean this private part, always remember from one side only, from the top to bottom. Okay. No way the other way around. You see the arrow from here to here and here to here. Okay. For the females, always remember to go down in one direction only. Yeah. Okay. So the third step is how you going to secure the tube. Okay. Usually we secure the tube is at the lower abdomen. From here you can see that the tube is secure here. This is imaginary, and this is the lower abdomen. Okay. So, always you tape here somewhere here. Okay. And we always use the 2x4-inch tape. Okay. So, always remember to loop it, that means just to show them how to loop it. Okay. She will show you how to loop it and secure it. So, it will prevent the traction. Okay. And always remember every day you must change the taping and try to put at different area. Okay. Okay, so you see how they tape it, it's like that. Okay, so it will not move and will not cause any traction. Okay. Okay, so it's always important to ensure that it is the bag is at the correct position, otherwise the urine will not drain properly. So if you see that the picture, okay, the urine bag always supposed to be below the waist level, so the urine can drain out. Okay, and it should not touch the floor. Okay. So always make sure this tubing is not kinked like this. So if it kinked like this, it will not, the urine will not flow out. Okay. So if you are going, okay, whenever you have urine catheter, you can still go out. Okay, how you going out? You know, this kind of strings that you can buy. Okay. So basically what we will do is the string should be inside, so you can tie around your waist. Okay. So if wearing like this, you always cover it like that, so the bag will be inside. Okay. So nobody will realize that there is a bag lamp, but always remember you must drain it out before you go out. Okay. So how to maintain perineal hygiene is very important to maintain to prevent infection and all. Okay. So you can shower as per normal. Okay. So when, okay, especially if your loved one were using diaper or bed bound, when you clean, you must always remember from the front to the back to the anus you have to clean. Okay. You can only go one direction, not the other way around. From always must be front to the back. Okay. And always remember, I know everybody like to use powder, smell nice and cream and everything. Do not use, because this may cause you infection. Okay. So it is advisable not to use. Okay. So and for males, if there is foreskin, always remember to retract the foreskin and clean thoroughly, then reposition the foreskin. Always must remember to reposition the foreskin also. Okay. Let's see how we empty the urine bag. Okay. Always remember to empty the urine bag before you sleep, and always whenever it fills half of the bag, it is supposed to drain, and whenever you go outside, you drain before you go outside. Okay. So you can use wet tissues or alcohol soap to drain. So yeah, they will show you how to drain the urine. So always clean the outlet before you cleaning, then pull down, then you drain the urine. Okay, pull up, then you clean. Okay, pull up, after that then you clean. Okay. Okay, clear? Okay. So okay, this is my last slide. So when you will have to go and see a doctor, and when you realize that there is a problem, always remember we experience abdominal pain, or your groin have pain, or you feel like you have fever, you see blood in the urine, the urine smell very cloudy, or very foul smell, or you see the urine is leaking out from the catheter side, and you see the skin is very red or inflamed, this is a sign for you to see doctor. Okay. And sometimes you see that the catheter is not draining out. Okay. So it can be because it may be kink. So you have to check the tubing whether it is kink. If it is kink, you must straighten it out. Okay. So sometimes it can be because the catheter may be blocked. So if you see and you drink water, then no urine is coming out and you feel like very bloated here, it is time for you to go and see doctor. Okay. Yeah, that's all. Thank you. Any more questions?
So okay. How many hours must we drain?
The bag is depends on how much is the urine inside, like half fill. But let's say if the urine is always very less, you can drain like 8 hours like that.
Oh, okay.
1 week. Yeah.
It's the bike changing is it? Are you asking the bike changing? Okay, it is depends. It depends. Sometimes the hospital we encourage to change frequently, but at home, whenever you change the catheter, you can change like 1 month. It depends. But you see, it is so sedimented and it's very dirty. Then you can change.
I mean, before it being changed that time, this bag don't need to wash at all.
No need to wash at all.
The whole thing is to be disposed, right?
Yep.
When you change the catheter.
Yes, they will dispose everything. Yes, everything will be disposed. So you want to change, just change this one. You can always change. This one just connected here only. But if you are not trained how to change, only change. Otherwise, you may causing infection. Whether anyhow change. Okay. If they taught you how to change, please change. Otherwise, do not change. Okay, usually when your loved one go home, the nursing staff will advise you when to change and where to go and how to change everything. Sometimes the community nurse will come to your house, they will help you to change also. Okay, this is something like this. Okay, this is one type of catheter, you can feel it. This is a 100% silicone catheter.